Hi everybody, Stephanie here from the Michigan State University Veterinary Medical Center Rehabilitation Service. I'm making a two-part video for you today on passive range of motion. In this first video, I'm going to demonstrate the correct technique in performing passive range of motion. Part one is specifically going to focus on the thoracic limbs or the front limbs. In part two, I'll demonstrate passive range of motion for the pelvic or the rear limbs. What is passive range of motion? It's an exercise that you can perform on your own pet to help improve their joint range of motion. We use it when we have a patient who is unable to move a joint on their own, or if they have restrictions either due to neurologic or orthopedic or a post-operative condition, and they're unable to move their joints properly on their own. So when it's done properly, passive range of motion can reduce pain, it can prevent joint contractures, it can slow muscle atrophy, it prevents adhesions from forming between the muscle layers. It increases the blood and the lymph circulation, and it helps to keep joints lubricated. So the best time to perform it is usually when the pet is most comfortable, which is typically 30 to 60 minutes after they've had their pain medication, or during a time of the day when they are just naturally quiet and wanting to take a nap at home. We typically do 15 to 20 flexions and extensions per joint, and usually we do this 2 to 6 times a day, but your veterinarian will be the one to prescribe the amount for you. So I'm going to show you next what the actual technique looks like. Okay, so first you want to make sure that your pet is just as relaxed and as comfortable as they can be. We like the patient or the pet to be on their side. We call it in lateral recumbency, and we want the limb that we're working on to be on the upside. So I like to put a rolled towel underneath the limb just to give it a little extra support, make them more comfortable, and make sure that we're staying in the correct plane of the body. What you want to do is hold and support the limb above and below whatever joint that you're working on to give it as much support as possible. So I like to start on the toes and I work my way all the way up the limb. So what we do is we hold the limb above the joint that we're interested in. I'm going to work on this toe first, and I like to go each toe at a time. And then I go up to the wrist or the carpus, and then up to the elbow, and then up to the shoulder joint. So you want to move the joint until you feel a little bit of resistance. We call that the end feel. And so you don't want to go beyond what that end feel feels like. So it's just to the point where you feel a little bit of resistance. So we move the joint until we feel that end feel, and when we're working on a toe, we support above, and I'm actually moving the joint below. So here's the toe, so I'm going to flex it, and then I extend it, and then I flex it, and I extend it, and I flex it, and I extend it. And then I move on to the next joint. There's a flex, there's an extend, there's a flex, there's an extend, and a flex, and an extend. And then we do 15 to 20 per joint. I'm just doing 3 per joint just to demonstrate what the technique looks like. Good girl, stay. And I do every single toe first. And it's literally just flexing and extending very briefly. And then I move on to the next joint above, which is the carpus. Stay. So I'm supporting above the joint, and I'm supporting below the joint, and this is a flex, and this is an extend, and we flex and extend, and we flex and we extend. When working on the elbow, again, we support above the joint, and I have my hands below the joint to actually move the joint itself. So here is a flex, and extend, here's a flex, and an extend, and a flex, and an extend. When working on the shoulder joint is right here, so I like to put my hand over that joint to help support it, and then I use my hand below to pull the limb up and flex, and then I go underneath the limb to extend, and then again we flex and we extend. Let's do one more, finger stay. We flex and we extend. That's what the technique looks like. If you have any questions, email us at vetrehab@cvm.msu.edu. Thanks. Bye.